Dr. Joseph Telfair is here now, President-Elect for the American Public Health Association. Thank you and congratulations on your new role.
It's an honor.
As we look ahead, I know that APHA is really focusing on health equity. So I want you to talk to me about the distinction between equality and health equity.
Yeah. So the concept of equality assumes that everyone has the opportunity for whatever the benefits we have in society are. And that's something that is historically something we as Americans have always focused on. Inequities are taking that same idea, but making it the reality that we do not have that. And we didn't have that in a specific level, which is the systems of care, the systems that create opportunities for us to have either access, education about utilization of the type of healthcare we have in this country. And that's across the board, from the national federal level all the way down to the local community level.
So how do you think at this stage the public health community can play an important role in addressing racism and some of the other things that contribute to these health inequities?
Yeah, so a lot of these inequities actually grow out of a lack of understanding, as well as long-standing ideas about how society works, how people work, and who they are. Racism itself did not grow out of acontextually. It's not something that just came out of that. It's a historical fact and reality that we live in. However, education that is being done by many people, particularly those in this association, to combat that means that they're educating those people about the realities and the effects and the impact of that. As well as when you look at things like, why is it important, for example, for all people, to have access to good health care? It doesn't just affect their physical health. It actually affects employees, employment agencies and programs. It affects their families. It affects pretty much everything that they do. So the reality is that if we have these inequities and we have these social determinant influences that actually are not addressed, then what we're not doing is that we're contributing to the deleterious effect that's happening on society as a whole, because health affects everything.
Absolutely,
Right.
and clearly we are falling short.
Absolutely.
But that is not for lack of people who are committed to doing better.
Right.
So where can we look to maybe find a model, perhaps other countries, that might be able to show us a better way to do things?
Yeah. Well, we have multiple models actually, and when we look at this, we need to look at it as not a single factor or a single model. We need to look at multiple different types of models. So different countries have that model. We know that Northern Europeans in general put a lot of money into the overall social health and welfare of their citizens. So they know and they're convinced that by actually having a seamless approach to supporting support services, wraparound services, that you can then address pretty straightforwardly a lot of these other things without a lot of political and other type of influences that seem to mitigate this work. So we look at them for that. We can also then look at grassroots programs that exist in many of even African countries or South Asian countries, where people at the grassroots level, individuals have taken it upon themselves to begin to address what they see as inequities around them. So we have multiple models at all levels, and one of the things we do in public health is that we actually have a means to do that. For example, the association addresses the broad levels and provide a bigger umbrella picture, but we have many of our members who work at the local grassroots level that take upon themselves to begin to do work within the society around them. One of the major examples, if I could pull one, is just community gardens. Which is something that is run, but if you think about the impact of a community garden, not only does it feed people, and not only does it supply means for that, but it also brings people together, and it also provides a means to educate others about how simplistically you can take what little resources you have and expand those loaves and fishes, into something that will work.
That's a great example, because we think about we want to try to grow what is good.
Absolutely.
Dr. Telfair, President-Elect, APHA, thank you so much,
Okay.
and congratulations.
Appreciate it. Thank you, Tom.